Hair transplant is a procedure increasingly sought by many to enhance or restore their appearance and beauty. Many doctors are considering to include this service into their medical practice, but are aware of only the conventional technique called FUT. This video is meant to give an overview to the newer alternative technique, called FUE, the developments in the field of hair transplant, and also touch upon the differences in the strip technique from the FUE technique.
Dear friends, I am Dr. Tejinder Bhatti, the Director of Darling Buds Hair Transplant Center, a unit of Plaza Clinic based in Chandigarh, India. It is a pleasure to speak on the meditube.com for the CME in hair transplantation, titled Advances in Techniques for Better Results and Patient Satisfaction. Hair transplant is the latest addition to the armamentarium of a plastic surgery practice. It is the commonest surgical procedure amongst the male population, both in the United States of America and India. Due to the fact that 63.2% males suffer from baldness, the growth of this field is immense, given that knowledge about hair transplant as a safe and effective modality has percolated down to just 2% of the population. The specialty expects a 1,000-fold increase in the next 2 years alone. In times of economic stagnation, these are encouraging figures indeed. Amongst techniques of surgical hair restoration, FUT and FUE hold their pride of place. Gone is the era that associated punch grafting with bad pluggy doll head results. Today's FUE is a refined procedure that utilizes minuscule punches which range in size from 0.65 to 0.85 millimeters to provide an undetectable, natural result with high density without leaving a visible linear scar. Yes. 5 principal criteria must be met to make a surgical technique scientifically acceptable. It should be simple, it should be effective, it should be minimally invasive, its results should be reproducible, and lastly, it should have a standard tool. FUE has become popular since it meets all the first 3 criteria. However, since all doctors presently are not able to reproduce acceptable results, it is in the midst of a raging controversy. To add salt to the festering FUE wound, companies with commercial interests have vitiated its scientific climate. The history of development of modern-day FUE is just a decade old, with most of the research having taken place in the past 3 years alone. Dr. William Rassman and Dr. Robert Bernstein first published an article on the Fox procedure in 2003, and others took the cue from here. Dr. Woods, Dr. James Harris, Dr. Alan Feller, Dr. Arvind Poswal, Dr. Alan Baumann, Dr. Patrick Muamba, and our center, along with that of Dr. Lars Heitmann, have done considerable work using this technique and have perfected their individual methods of harvesting to perfection. The FUE under high magnification of Woods, the use of motorized machine utilizing the dull punch of Jim Harris, Feller's ingenious powered extraction tool, Arvind's unique and path-breaking expanding needle concept, Patrick and Lars' laboriously painstaking but perfect manual extraction method, Lorenzo's refinements in FUE graft placement, our rapid FUE harvest and golden harvest techniques, and last but not the least, the well-known suction-assisted minimally invasive FUE technique of Alan Baumann. The efforts of these FUE surgeons has so enriched the present-day FUE technique that the method is on the threshold of being accepted as the foremost method of hair transplant today. As a well-known surgical hair restoration training center, and having trained over 135 doctors in the past 2 years alone, we realized and projected the immense force of FUE, its wide acceptance being minimally invasive in nature, and the value it brings to the field of surgical hair restoration. Most doctors we trained were willing to learn only FUE after seeing the potential of the procedure to harvest a large number of grafts in a single session. Having done FUT with pride for many years and now witnessing the gradual decline in its acceptability, it is rather heartbreaking since we at our center have seen great results with the technique. It was, however, our conscious decision to switch over to FUE, keeping in mind the increasing demand of the procedure in India, amongst a population which is wary of surgical techniques for cosmesis, situations where FUT still holds fort. However, we continue to offer the strip method to patients with female pattern baldness and type 6 male pattern baldness to enhance the yield from scalp hair. It has been our experience that even in this minuscule subset of patients, they would rather have grafts harvested by the Fue technique from the scalp and the body rather than live with a visible linear scar all their lives. While we do project Fue taking over the hair transplant market in the coming 1 year, even in the USA, which is the strongest and most resilient FUT bastion, a large tsunami wave of complications is about to hit the specialty very soon and will raise doubts in the minds of prospective clients regarding hair transplant procedures as a whole. Since the FUE market has been vitiated by commercial interests, this momentary loss of FUE reputation shall nonetheless be made up by isolated clinics around the world which practice ethical, effective and safe FUE using safe systems for their clients who have reposed trust in their practice. We project that after this fleeting moment in FUE's timeline and by the year 2016, FUT shall no longer continue to be popular. It shall be used as an adjunct to FUE like the flute procedure in our clinic, presently for a small subset of clinical situations of hair loss. The large number of doctors jumping onto the FUE bandwagon with very little learning is alarming. Some FUE systems tout their wares by falsely claiming that their machines can be a value addition to any clinic not doing hair transplant routinely, implying that the machine would be able to do all the work. The suction-assisted hair transplant technique and the robotic variations, to our mind, are just commercial gimmicks. Due to this shortcoming in FUE, as perceived by the physician community, the gold standard of this decade shall continue to be the FUT till FUE completely takes over once our drawbacks get ironed out. With so many FUE harvesting systems in the market today, will FUE ever have a standard tool? Most believe that the James Harris system and its simpler variants shall soon be the industry's standard tool, and a semi-sharp variant of the dull punch would be most commonly used. However, the Harris FUE technique, being painfully slow, shall not last. Thus, the machine shall outlast the technique. Also remember, it is not the machine which does the work in FUE. It is a mere tool in agile, discerning hands with an alert, adaptable mind behind them. Remember, the surgeon is not a slave in the hands of the tool he uses. It is the other way around. No magic wand exists in any field of medicine, and hair restoration is not an exception.
Hair transplant is a procedure increasingly sought by many to enhance or restore their appearance and beauty. Many doctors are considering to include this service into their medical practice, but are aware of only the conventional technique called FUT. This video is meant to give an overview to the newer alternative technique, called FUE, the developments in the field of hair transplant, and also touch upon the differences in the strip technique from the FUE technique.
Whereas the benefits of FUE are patient-centric, its disadvantages are just doctor-centric. Dealing first with the benefits of the technique, FUE is a minimally invasive procedure that utilizes a large donor site limited only by the bounds of one's imagination, with the ability to harvest 1200 to 2000 grafts an hour with constant practice. It gives additional freedom to sport a short hairstyle since there is no visible linear scar, since minute scarring has been distributed over a large area. African and grey hair can be better harvested without transection using FUE since the technique is based on feel rather than on sight. The transection rate in FUE varies from 1% to 5% in better centers. However, the transection rate is not to be confused with the wastage rate in FUT, since in FUE the roots are still embedded in the scalp and shall live to be harvested again. In FUT, they go into the bin. With FUE, healing is faster and pain after the procedure is almost nil, Therefore, surgical downtime is much less and the client can return to work after 48 hours. Last but not the least, better quality control can be exercised since the doctor harvests all the ready-to-plant grafts. As far as pre- and post-operative preparation or adjunctive care is concerned, the client is given an exhaustive list of do's and don'ts a month before his procedure is due. This entails scalp hygiene measures, stopping topical applications, avoiding use of medications which enhance hyperemia or redness of the scalp. Post-operative care lasts for 2 weeks after the procedure. The patient is advised to follow a rigorous routine of twice-a-day care. The client must be followed up on phone intermittently for the 14 days post-procedure. Lastly, medication like tablet biotin, minoxidil and finasteride in acceptable doses is prescribed for 6 months following the procedure. To conclude, I would like to state that though a raging controversy denigrating Fue technique has spread over all 5 continents like a raging forest fire, the final arbiter shall be the happy client who will embrace Fue, since the proof of the pudding will be in the eating. Thank you.
Hair transplant is a procedure increasingly sought by many to enhance or restore their appearance and beauty. Many doctors are considering to include this service into their medical practice, but are aware of only the conventional technique called FUT. This video is meant to give an overview to the newer alternative technique, called FUE, the developments in the field of hair transplant, and also touch upon the differences in the strip technique from the FUE technique.
Dr. Tejinder, why is it that FUE is not reproducible in the hands of many surgeons, whereas in the case of a dedicated surgeon, the procedure can be executed to a high level of finesse and excellence, so that rapid FUE harvest and other features can be a part of this procedure? Is it purely due to lack of training, or is there something else?
FUE has a long learning curve, longer than that of the traditional FUT procedure. FUE requires long hours of patient learning under high magnification. Once you take up FUE as a profession, you are married to it, since it requires the whole day to accomplish if the doctor is going to do the whole harvesting himself. Most surgeons cannot use high magnification. They cannot sit for long hours in difficult postures. They usually cannot leave their lucrative dermatology or plastic surgery practices, which they are used to, in favor of FUE, which requires complete sacrifice of time and attention. They cannot leave doing FUT procedure, which gives them a lot of free time for other avocations, since a strip surgeon typically spends just 1 hour in the operation theatre. Lastly, FUE learning centers are few. Since it is a new technique, most centers remain closeted with their technique and do not open their doors to those seeking FUE training.
How is FUE different from FUT, both technically and conceptually?
FUT is currently the gold standard of surgical hair restoration. FUE is different from it only in the manner of harvesting. In the former, a strip of skin as wide as 2 centimeters at times and as long as the number of grafts needed is taken, whereas in the latter, minute punches are used to individually extract follicles either manually or mechanically and with or without the assistance of a robot. The main differences between FUE and FUT are 5-fold. FUT gives a visible scar, FUE does not. There are great FUT scars and there are great FUE scars, but in general, and having performed both procedures passionately, there is no beating an FUE scar in the same hands. Due to its minimally invasive nature, the recovery after FUE is faster and downtime lesser. All other advantages of FUE over FUT are fictional and market driven. Anagen selective harvest, or the golden harvest of our center, permits the surgeon to cherry pick the most robust grafts for a better result. In FUE, the donor site is limitless, restricted only by the bounds of one's imagination. Lastly, dormant hair in the resting phase are not lost in FUE. The above 5 have no place of rebuttal even by the most die-hard FUT surgeon. The golden harvest refers to anagen selective harvest. Anagen selective FUE grows better hair. The hair in FUT, which are in regression phase, have a high chance of going into dormancy after the surgical assault. Hence, the density obtained after FUT is less than after the golden harvest procedure of FUE, in which only hairs in the anagen phase are selected.
So what is the flute technique, FLUTE?
FUT can be combined with FUE for a select group of patients. This is termed follicular unit transfer with enhancement. Types 5 and 6 with low density may be advised both procedures to enhance the graft yield.
Dr. Tejinder, what are the misconceptions about the FUE technique that may be misrepresented by those indulging in propaganda?
Most surgeons advertise saying there is no scar. The truth is that the scars are present but are not visible since they are scattered. The second misconception is that FUE gives better density. Well, there is no difference in density in either technique if you have selected your surgeon with due diligence. So take your time, do your research and choose a good surgeon and whom you are comfortable with. Thirdly, companies do claim that FUE can be done by novice surgeons if they use a particular machine. These tall commercial claims have done much disservice to the technique of FUE.
So what are the principles of the various steps in this procedure of FUE?
FUE is the harvesting of follicular units using refined minuscule punches which may range in size from 0.65 to 0.85 millimeters in internal diameter. The system used may be motorized or robotic. Manual FUE is waning in popularity due to slow pace of the procedure, allowing just 500 to 800 grafts harvested in an 8-hour session. It is only the harvesting that is different in FUE, the remaining procedure remaining the same.
What are the complications of hair transplant as a whole that may bring disrepute to the procedure in general, especially those which may have catastrophic outcome?
We see young surgeons falling to the propaganda of companies selling their wares. There is a common misconception that some machines do all the work, which is absolutely unfounded and spread by unethical companies. The complications are going to arise from a large number of FUE surgeons who are untrained and rely on these machines. It shall take another 2 years for establishing a standard of care in FUE technique.
So how do you go about with candidate selection for FUE, keeping in mind contraindications and role of pre-operative preparation and also adjuvant therapy when you go about preparing for a case of hair transplant surgery?
All patients who are candidates for FUT are candidates for FUE. However, FUE has widened the horizon of surgical hair restoration by allowing the surgeon to look beyond the traditional donor sites. Firstly, for candidate selection, all clients who do not have unrealistic expectations and have more than adequate harvestable grafts can be considered candidates for hair transplant. Types 5 and 6 male pattern baldness with poor donor density and without much body hair to bank on may benefit by the flute combo method. However, if the scalp donor density is adequate, the hairline and mid-scalp can be covered in the first phase by FUE alone. Today, if a candidate is fit for FUT, he is a candidate for FUE too. I would not do a hair transplant in a diabetic with uncontrolled levels 1 month before the procedure, or patients with skin diseases like psoriasis, or even unrealistic expectations. Secondly, as far as pre and post-op preparation adjunctive care is concerned, the client is given an exhaustive list of do's and don'ts a month before his procedure is due. This entails scalp hygiene measures, stopping topical applications, avoiding use of medications which enhance hyperemia or redness of the scalp. Post-operative care lasts for 2 weeks after the procedure. The patient is advised to follow a rigorous routine of twice-a-day care. The client is followed up on phone intermittently for the 14 days post-procedure. Lastly, medications like tablet biotin, minoxidil and finasteride in acceptable doses is prescribed for 6 months following the procedure.